My name is Creig Hoyt. I'm at the University of California in San Francisco.
And I'm David Taylor. I'm at University College London. I think the primary audience will be a professional pediatric ophthalmologist, and he or she will have the book, we hope, much used in their office so that they can look things up themselves, go online to look things up, and with the book show the parents pictures of what their child may have or something similar to that. So that's the primary, but I think there are others who will use it as well.
Yeah, I think that is right, particularly for the hard copy, but one of the things we really appreciate is that it's going to be on a number of electronic platforms, and I think there will be people who are in training who A, will be able to afford it, and B, will prefer that format anyway. So we would certainly hope that a number of trainees would use it as well.
I think the new format is going to be terrific, actually, from the point of view of searching and utility, and the other connections of it will be unique to me anyway, and I think it's pretty new in pediatric ophthalmology.
I agree. I think the big difference is what publishers are experiencing, in other areas about books in general. If you take most people who are in training now, our house staff, house officers, they are doing almost everything online. Very few of them have big collections of hard copy books at home, but they read, and they read avidly, and they're extremely facile with the electronic format. And we were very excited that Elsevier was not only willing but insistent that we were going to have multiple electronic options, and that this was going to be a major part of this edition. I think it's fundamentally important because there's a whole generation of people who that's their way of getting information. And the same user may use the book in different formats. As David said, here's the consultant in their rooms seeing a patient with a family and having the book available, and to show the pictures and to Xerox the pages and give it to the parents and say, here's a description of what your child has, is very useful. But that same consultant might, in another situation, be quite happy to go search fairly quickly in an electronic format as another way of getting information, in another environment. So I don't think it's exclusive that we're saying that the electronic format is just going to be young people and the hard copy is just going to be older people. I think, there's obviously a mixture of usage. Well, I think in the electronic format, it's affordable for a resident or registrar to use, and I think it's the kind of format that they like to use. They're not as likely to want a hard copy. So I think it is something that, they can use and will use. I think the hard copy will be primarily in the situation that David described, that it will be the practicing pediatric ophthalmologist in their consulting rooms with the patient and the family. Certainly one of the nice things about putting this type of book together is you can ask younger colleagues who have become experts in the field to be major contributors and mentor them in the contribution to the book, and it's certainly, part of it. But I think if you're going to do a book like this, you have to have some interest in the writing process and books in general, that you're willing to put that, effort into it. And I think that's the driving force, for both of us.
As part of our work, right from the beginning, really, we've traveled quite a lot to lecture and talk and sometimes see patients and that sort of thing abroad in lots of different countries. And I can tell you, when you go into somebody's clinic and there's the book rather battered on the side, it's been much thumbed through, and they say, can you sign it? Now, that is really terrific, because they know that you've really that you've really made a difference to their patients, and that's it's not us that's done it so much as the authors that have done it, and that's good.